Current drug abuse situation in Malita. Malita, Davao Occidental is facing significant challenges related to drug abuse, as evidenced by a recent incident involving drug operations. The local government unit of Malita and the law enforcement agency are grappling with drug-related activities which pose threat to the community safety and public health. This situation necessitates a proactive and comprehensive intervention plan to address the underlying issues contributing to substance abuse within the municipality.
Statistical data regarding drug abuse, existing intervention plan, and existing stakeholders and available resources. This year alone, there have been approximately 3 reported cases of drug-related arrests in Malita, highlighting ongoing issues with methamphetamine, locally known as shabu, distribution in the area. Currently, the Barangay Anti-Drug Abuse Council or BADAC is actively implementing the Barangay Drug Clearing Program, which aims to eradicate substance abuse through community engagement and rehabilitation efforts. While these initiatives have shown some effectiveness, challenges remain in terms of resource allocation and community participation, despite the existence of some stakeholders in Malita like local government units or LGUs, BADAC members, the Philippine National Police or the PNP, community organizations, and healthcare providers, and support from the non-governmental organizations or NGOs.
The proposed intervention plan tailored to Hichanova et al. 2018. In light of the escalating drug abuse crisis in the municipality of Malita, we are proposing the development of a comprehensive community intervention plan aimed at addressing the multi-faced challenges posed by substance use. The urgency of this initiative stems from recent statistics indicating a drug-related incidents which have not only affected individuals but also strained families and communities. The findings from the study by Hichanova et al. 2018 are particularly relevant to this intervention plan. Their research emphasizes the necessity of culturally appropriate, community-based drug recovery interventions that address the psychosocial needs of Filipino drug users. In Malita, where traditional methods have often relied on compulsory residential treatment, there is a pressing need for strategies that resonate with local customs and social dynamics. By incorporating family involvement and community support into our intervention plan, we can create a more effective framework that facilitates individual recovery while strengthening the community ties. Therefore, our intervention will include components that focus on enhancing family support systems, reducing stigma through education, and providing accessible mental health resources. In Malita, these elements are critical as they influence individuals' willingness to seek help and participate in treatment programs. By aligning our intervention plan with insights from Hichanova et al. 2018, we aim to develop a holistic approach that not only addresses drug use directly but also fosters an environment.
Recognizing that drug use affects not only individuals but also their families, the intervention will incorporate comprehensive family engagement strategies. This includes regular family counseling sessions designed to improve communication and understanding among family members, helping them navigate the complexities of recovery together. Educational workshops will be organized to inform families about the effects of drug use, effective coping strategies, and how can they best support their loved ones during recovery. Additionally, the establishment of support groups will provide a safe space for families of individuals who suffer with drug addiction to share their experiences, challenges, and successes, fostering a sense of community and mutual support. To combat the stigma associated with drug use and recovery, the plan will implement community-wide awareness campaigns that highlight addiction as a medical condition rather than a moral failing. These campaigns will utilize various media platforms to reach a broad audience and will include success stories from individuals who have overcome addiction, aiming to change public perceptions. Furthermore, school-based programs will be developed in collaboration with local educational institutions to integrate drug education into the curriculum. These programs will focus on prevention strategies and promote healthy lifestyle choices among youth, equipping them with the knowledge and skills to resist drug use. Community forums will also be organized to encourage open dialogue about drug-related issues, allowing residents to ask questions and discuss concerns with local health professionals. In addition to family involvement and stigma reduction efforts, the intervention will prioritize access to mental health resources, recognizing that many individuals who suffer with drug addiction may also struggle with co-occurring mental health issues. Routine mental health screenings will be implemented for individuals seeking help for drug use, facilitating early identification of co-occurring disorders that can complicate recovery. The integration of services from local healthcare providers will ensure that individuals receive comprehensive care tailored to their unique circumstances, addressing both mental health and drug use needs effectively. To further enhance local capacity, training programs for healthcare professionals will be established to equip them with best practices for treating individuals who suffer with drug addiction and co-occurring mental health disorders. By aligning this intervention plan with insights from Hechanova et al. 2018, we aim to develop a holistic approach that not only addresses drug use directly, but also fosters an environment where individuals feel empowered to change. Engaging families as active participants in the recovery process will not only improve individual outcomes, but also strengthen community ties and resilience against substance use issues. Ultimately, this intervention plan aspires to cultivate a healthier community where individuals can thrive free from the burdens of addiction.
Measures to strengthen law enforcement efforts. Law enforcement plays a crucial role in the proposed community intervention plan for addressing drug abuse in Malita, Davao Occidental. Their involvement is essential not only for ensuring public safety, but also for facilitating access to treatment and support for individuals struggling with substance use. Law enforcement agencies are often the first point of contact for individuals in crisis, giving them a unique opportunity to intervene and redirect individuals toward rehabilitation rather than incarceration. Moreover, integration of law enforcement efforts into this comprehensive intervention plan will strengthen the overall response to drug abuse in Malita, ensuring that strategies are effective, culturally relevant, and aligned with the community needs. First, community policing initiatives. To build trust and cooperation between law enforcement and the community, implementing community policing initiatives will be essential. This approach encourages police officers to engage with residents actively, fostering relationships that promote open communication about drug-related issues. Officers can participate in community events, educational workshops, and support groups, which will help demystify their role and reduce fear among residents. By being visible and approachable, police can encourage community members to report suspicious activity without fear of retribution, creating a safer environment for everyone. Second, training for law enforcement personnel. Training programs for law enforcement personnel should be developed to equip them with skills in handling drug-related cases with empathy and understanding. This training would include modules on motivational interviewing techniques, which can help officers communicate effectively with individuals struggling with substance use. Additionally, training should cover the importance of recognizing the psychosocial factors influencing drug use as highlighted by Hechanova et al., enabling officers to approach cases with a more holistic perspective that prioritizes rehabilitation over punishment. Third, collaboration with community-based programs. Law enforcement agencies should actively collaborate with community-based programs such as Barangay Anti-Drug Abuse Council and the Katatagan Kontra Droga sa Komunidad. By working together, law enforcement can support these initiatives by providing security during events and facilitating access to treatment resources for individuals who voluntarily surrender or seek help. This partnership can also involve sharing data on drug-related incidents to better inform community interventions and allocate resources effectively. Fourth, implementation of technology for monitoring. Utilizing technology such as data analytics and surveillance systems can enhance law enforcement ability to monitor drug-related activities in Malita. By analyzing patterns of drug use and trafficking, law enforcement can identify hotspots and deploy resources more strategically. Additionally, technology can facilitate communication between police and community members through anonymous reporting apps or hotlines, allowing residents to report suspicious activities discreetly. Lastly, public awareness campaigns. Law enforcement should lead public awareness campaigns aimed at destigmatizing drug use and promoting recovery as a viable option. These campaigns can include educational materials that inform residents about the nature of addiction as health issue rather than a criminal one. By collaborating with local health organizations, law enforcement can provide information on available treatment options, encouraging individuals to seek help without fear of legal repercussions.